But anyway, welcome to the webinar tonight. Thank you so much for joining in. And it's really lovely to be here and have the opportunity to talk to you. So I hope you get a lot of information out of this. And for anybody who needs to leave, we will be sending you the email link. So you'll be able to click in later and look at it later if you'd like to. Now, there is a chat box. If you have a look down in the bottom of the screen, there is something that says chat with a little chat icon. If you need to ask me a question while I'm doing the webinar, you can just type one in there, and I'll keep an eye on that and try and answer those as we go along. And if I don't get to it, then I'll certainly be answering questions at the end. So I hope that covers everything else. I've been muting anybody who hasn't turned off their microphone. So it's just easier if it's just me talking rather than having people interrupting. And that's where the chat box, typing in a question is much more helpful for me and for everybody else, I think. Right, so tonight I'm talking about cognitive decline and Alzheimer's disease. And what I want to really talk about is the various factors that can create Alzheimer's or cognitive decline, and also things that you can do about it. But I will go into quite some detail. So it is quite an in-depth webinar with lots of information. So hopefully you'll find that helpful. And everybody looks like they're muted. That's just popped in. Right, so I was just fixing up that. So, right, let's get started. So I thought what I might do is share my screen. And this is where I can go through my PowerPoint presentation with you. And what I'd like to do with that is go through all the information in that, and then I'll pop back out of that at the end so that you can ask questions as well. But like I said, I'll keep an eye on that chat box. So with cognitive decline, first of all, there's some statistics I thought we should look at. And the risk does increase with age and affects 1 in 10 people over 65. And also 3 in 10 people over 85. The baby boomer generation, they predict, could see Alzheimer's disease rates triple by 2050, which in fact, it was when I first heard those statistics that I really felt a bit frightened, because that's quite a lot of people, as you'll see. And I know that there's so much that you can do to help prevent a cognitive decline and Alzheimer's. So I think that's really what drove me into this field. You obviously realize I'm a naturopathic nutritionist at Remedy Wellness Medicine. And I've been working in this field now since 2017. So for a while now, and it's such an interesting field to work in. And my favorite is always going to be, working on prevention as much as possible, or at least seeing people at the very early stages before things develop too much, because there is a lot that you can do with that. So just getting back to that, the dementia is the second leading cause of death in Australians. And also it's the leading cause of death for women, mainly because women typically outlive a lot of men. And also we have a lot of other factors at play, such as hormones dropping and so forth. So in 2023, over 28,000 people are likely to have younger onset dementia. So younger onset dementia is under the age of 65. And then by 2058, that's expected to be over 42,000 people in that age group. In 2023, over 1.5 million people are helping with the care of somebody living with dementia. And more than 2/3 of the aged care residents have moderate to severe cognitive impairment. It's a bit grim, isn't it? So here, let's have a look at some brain anatomy. I'll just get my little laser pointer. So these are the different areas of the brain, and quite often, you know, somebody with a diagnosis of Alzheimer's might have had an MRI, and it could say that there's some, you know, issues with the temporal lobe or the frontal lobe or the parietal lobe, or, you know, the cerebellum and so forth. Sometimes you see frontotemporal cognitive decline. And so that's where, you know, this area of the brain is affected. And in the next slide, there's also an important area in the brain called the hippocampus. And so this one is very much affected by chronic stress. And you think about people, you know, like just regular people who have got intense stress for a period of time, or people who are, you know, that I would think of people working in the army who are working in very, very intense, scary situations, and they can have some hippocampus effects from that extreme stress. And it's, you know, kind of in this area, and also the amygdala, which is like our ancient brain where fear and survival comes in, that can be quite affected in post-traumatic stress disorder. Here we're looking at the cross sections of a healthy, normal brain on the left. And you can see these sections here are language and memory. And then in an Alzheimer's brain, you can see how it's just shrunk. And the shrinkage is due to actual tissue damage, and how the memory and language can become affected from that. So here we have, again, you know, that same sort of picture, but on a different angle. And I'm just going to put, I don't think I can. Oh, yes, I can. I'm trying to get rid of my little picture so I can see. So a neurodegenerative disorder, you know, involving damage to the tissue. And then Alzheimer's disease accounts for 70% of dementia cases. And with Alzheimer's, there's that shrinkage that I talked about, which is due to the tissue damage or cell death. And those areas of memory and language and judgment are affected. Amyloid plaques also build up in Alzheimer's, and that can impair that signaling of the brain cells to each other. And then there's these neurofibrillary, I can never say it, neurofibrillary tangles, try saying that quickly. And these also then are caused by tau proteins, and then that affects how the nutrients get to the brain cells. And so here we can see the normal side, and on the other side we can see these disease processes all occurring. So the signs and symptoms of Alzheimer's, so they can be very subtle to begin with. And then there can be some persistent short or long-term memory loss. There can be changes in personality behavior, vagueness in conversations. You know, somebody will be talking and then they kind of drift off because they've just lost the total thread. Forgetting well-known people or places, how to get places as well. Poor word recall, lack of social skills, and a lack of enthusiasm for activities that that person previously enjoyed. That's always sends up a big radar or warning bell for me when I hear that sort of thing. An inability to learn new tasks or to process instructions. And mood fluctuations. It can be, you know, depression, it can be anger, frustration. It's all very much tied up with, you know, just not functioning at your best. Now, there are some genetics involved with Alzheimer's, and one of the ones that I talk about quite a lot with my patients is the first one, which is the apolipoprotein ApoE4, we call it for short. I'm going to talk a bit more about that in a minute, but the next two are very rare, and as you can see, they're only in less than 1% of the population. So they're most likely related to familial, like very strong familial Alzheimer's. And while, you know, there can be familial Alzheimer's, generally speaking, from all kinds of reasons, but this is like a really strong family-based one. But let's have a look at the ApoE4 gene. And so with the ApoE4, you can have one copy or you can have two. And one copy is thought to increase your risk of Alzheimer's by about 35%. And having two copies can be as much as 75%. And so, as you can see on the left side, the gain of toxic function because of this gene is the problem. You know, it can be unusual brain activity, more of those tangles that I mentioned, the amyloid beta accumulation, neuronal toxicity, and that shrinkage of the brain. And then there's this decrease in the synapses or the messaging in the brain cells. There's problems with the glucose metabolism or potential. This is all potential. Neurogenesis, that's the production of new neurons in the brain, can be less. And that clearance of the amyloid beta plaque can be less. And vascular function might be dropped. The whole mitochondrial function can be lessened. And mitochondria, where you produce energy in the cells. And you can have problems with lipid and cholesterol metabolism, which then, you know, part of the ApoE4 gene is the cardiovascular risk. So the main thing to remember with the ApoE4 gene is that you're not necessarily going to develop Alzheimer's if you have one or two copies, but knowing about it can be really helpful in prevention. And it's really important that you think about genes as being like the gun, and that your diet, your lifestyle habits, and your toxin exposure are the things that can pull that trigger of the gun or make those genes become expressed so that they, you know, aren't working as properly as they should in that field. I'm going to talk about a little bit more about ApoE4 genes as we go along, but just on the ApoE4, there's ApoE3. There's also the newer one. It's been around for about 80,000 years, so it's new compared to the ApoE4, which is very ancient. It's like the Paleolithic genes, if you like. The ApoE3 is quite a neutral gene risk for Alzheimer's. It doesn't mean that you won't develop Alzheimer's if you have the ApoE3 genes, and likewise with the ApoE2. So other genes I like to look at are the MTHFR, or the methylation genes, inflammation genes, detox genes, the genes that give an indication if you're likely to have problems with some of those nutrients, such as B12 and B6 and so forth. Oxidative stress genes, the BDNF gene. BDNF is brain-derived neurotrophic factor, which is a really important substance that the brain produces. The KIBRA gene, and also a KIBRA gene is like a memory gene, and stress and anxiety genes. So for me, they're really important because stress for some people really does downgrade their cognitive ability. So the current treatment process, patients often don't seek medical care, or they might just go, oh, look, I'm just getting older, it's normal to forget things or to have problems, you know, remembering names and so forth. And primary care providers often don't refer, mainly because they don't believe that there's any effective therapy or something that can be done. And the specialists, some specialists are starting to talk about diet a lot more, which is fantastic. But in terms of medicines, there's only a few pharmaceuticals which have very limited ability to help with Alzheimer's. It can, or some of them can, kind of decrease the progress for a time, but not so much after that short time. So the main thing to remember with amyloid plaque is that amyloid is not the cause of Alzheimer's. It's a protective response to whatever's going on in the brain, where the brain needs to protect itself from, say, inflammation or toxicity or virus. So amyloid is not the bad guy per se. It's all these other drivers that we're going to look at. And Dale Bredesen, who he's the neurologist, Professor Dale Bredesen in the US, who has really started the ReCode way of thinking, or the ReCode Protocol, which is what I have studied under his work. And I first studied in the US in 2017, and just last year I upgraded my qualifications to the latest and greatest version of ReCode. Amazing information, and I enjoyed it so much. So Dale Bredesen says that rather than a disease, Alzheimer's should be viewed as a programmatic downsizing of the neural plasticity network, and that's to preserve the brain function for areas not affected. And also that it's not a mysterious, untreatable brain disease. Depending how early you get to it, it can be reversible, and it's a metabolic, toxic, and usually systemic illness with quite a large window for treatment. And so he, you know, totally recommends, rather than just taking one pill and hoping for the best, that it really should be replaced by a program of care addressing the drivers. So on that note, the subtypes of Alzheimer's drivers, or cognitive decline drivers, and for that matter, you could look at this list and say, well, these really are the drivers of chronic disease, such as Alzheimer's, cardiovascular, cancer, you know, in some cases, diabetes. So just addressing these is going to make you so much healthier in so many ways. So number one is inflammatory, and things that can cause inflammation, things like leaky gut. I'm going to talk a bit more about that. neuroinflammation, infection, genes, your gene disposition. Glycotoxic, so that's where there might be blood sugar and insulin issues, and often combined with toxicity. Atrophic, that's where the brain is quite characterized with memory loss, but all of these can affect that. Lack of nutrients and sex hormone imbalance and so forth. And then toxic exposure is a major driver for young onset Alzheimer's. Also having a history of depression, and you can have word finding problems, maths and organizational problems. You could be very sensitive to stress. So infections, mold exposure, chemical and heavy metal toxicity might be involved here. Vascular, so this is where the tiny capillaries in the brain might be affected. They might not be functioning at their best. And, or for example, think about when you have a tiny transient ischemic attacks, that's little tiny strokes, or, little tiny clots in the capillaries of the brain that can then kind of close off that nutrient supply to those brain cells, creating that vascular injury. And traumatic. So obviously that's a trauma to the head. So neuroinflammation, chronic inflammation in the brain can cause that activation of the immune cells in the brain, which then creates that hyperpermeability of the blood-brain barrier. So the blood-brain barrier is a really important thing to consider in this. And quite often I'll say, leaky gut. You might have leaky gut, for example. Well, automatically, if you have leaky gut, you're likely to have problems with your blood-brain barrier. And that is because when we were first produced, if you like, when we were first developing in utero, the cells for the brain and the gut separated and were joined together by a vagal nerve. And so it kind of separated out, and we had these different things developing. And so we've got this connection between our brain and our gut, which is so important to consider. So the gut, I always call the gut the petrol tank. And you think about if you have a dodgy petrol tank, that's your car's not going to run very well. Rapidly, so when this happens, when you have that increase of the permeability of the blood-brain barrier, then you can have these pro-inflammatory messengers or cytokines can go into the brain and then start causing that dendritic retraction, which is the neurons and so forth shrinking. And of course, then that's going to lead to an acceleration of cognitive issues. And it also reduces that resilience to form new neural pathways. So inflammation is such a basic response to tissue damage, but what is damaging it? And we're going to look at some of those things now. So we've talked about plaques and tangles, and Alzheimer's with neuroinflammation really does increase the progression and of symptoms and also, the disease processes. So let's look at the gut-brain connection. And so the imbalance of the microbiome in the gut can stimulate an increased inflammatory response in the body or the brain. Now, there is lipopolysaccharides, or LPS, can be produced by some bacteria. And if there's leaky gut, then they can migrate from the gut into the bloodstream, or, little particles, microscopic, of course, we're talking about, and they can migrate into the brain. And also that they've been found in plaques, in the artery plaques. So it's not just the brain that's at risk there. And causes of leaky gut can be things like antibiotic use, which has upset the balance of the microbiome. Chronic stress is a really big one. Poor diet, gluten, chlorinated water, because chlorine is an antibacterial. And if you're drinking chlorinated water, then you're actually drinking an antibiotic of sorts, really. Environmental toxins, alcohol, particularly in excess, and some medications can kind of cause some damage or can compromise the gut wall, and that's the protein pump inhibitors, which are the ones that help to squash the stomach acid for people with reflux, and a couple of those common painkillers. So this is just a simple diagram of leaky gut, and you can see here in this section there's normal type junctions in the healthy cells lining the gut. Just imagine this is where the food is going through there. That's like the tubing, if you like. And in leaky gut, those junctions become more porous, and that allows, these byproducts from bacteria, tiny microscopic particles of food, and other toxins from the body to get into the bloodstream. And then then you end up with like a systemic problem, because that bloodstream, it goes all around your body. And so you could develop food intolerances, inflammation, autoimmune conditions, malabsorption, nutrient deficiency, and that blood-brain barrier breach, of course. So let's look at insulin resistance. So that's something I check with all my patients. I think it's really, really key, because Alzheimer's has sometimes been called diabetes type 3. And that would be particularly for those people who have got insulin resistance or blood glucose problems. So just imagine that these are a cell, well, this is just your cells in your body. And to produce energy in a healthy cell, the glucose will come along in the bloodstream, and the insulin will then, if you like, knock on the insulin receptor, which is on the outside of the cell, and then that opens up the door and the glucose can go in, and then that can be used as energy to produce energy for the body, energy for the cell. Now, with insulin resistance, those receptors become less receptive, and so they don't open the door so well. So the body produces more insulin to try and get that glucose into the cell. And at the same time, you can have a buildup of glucose in the bloodstream. Now, if the body can't make use of that glucose, or all of it, it will change it into fat. It will convert it into fat, and then it can store it. And quite often that storage might be within the body cavity around organs or within the liver. And that then compounds the whole issue. So insulin resistance is an inflammatory type of process. So if you think that you're storing more fat within the body cavity, that's creating more inflammation, because that's not what we're meant to do. So we can also have insulin resistance in the neurons in the brain. And then, of course, that compounds all sorts of things and reduces that brain-derived neurotrophic factor and impairs the mitochondrial function, or the energy function in the brain cells. And insulin-resistant symptoms are quite often carb cravings, hunger, fatigue, weight gain. And, people with insulin resistance often talk about, when they have a meal with carbohydrate, they just feel like they need to have more carbohydrate. Like it's kind of this their body has gone a bit haywire, and telling them, look, you know, I can't process that glucose, you need to eat more carbohydrate, but where in fact you need to eat less carbohydrate to make less of a load on the body so the body can, you know, gradually make use of it. And a lot of people with insulin resistance, if I put them onto more of a ketogenic type diet, very low carb, they feel much better and they have much better energy. So more risk and contributing factors, we've got infections. So this is something else I look for my patients with cognitive issues or who want to prevent cognitive decline. And so these infections can just be cooking along under the surface, and they need to really be addressed. And one is a sinus infection. So if you have had chronic sinus issues, then it's definitely worth having a nasopharyngeal swab test done. And what I'm looking for specifically is any fungus infection or mold infection in the sinuses, and also an overgrowth of this bacteria, which is multi-antibiotic resistant coagulase staphylococci, or marcons, which is much easier to say. H. pylori infection, so that's the infection that was discovered by West Australian, which was shown to be the cause of stomach cancer. And so that's literally, it's a type of bacteria that grows within the stomach in some people who are affected. Dental infections, so going and having your teeth cleaned, flossing your teeth every single day and brushing twice a day is absolutely crucial. And getting your teeth just cleaned and checked on a regular basis to make sure there's no dental disease. The Epstein-Barr virus, which is glandular fever, that will stay, or the type of antibodies showing that you've had that infection will stay within the body. And in some cases, they can reactivate. A lot of people who have had glandular fever say that if they push themselves too hard, they can really get tired very easily. And so this is quite often the case. It's kind of just lurking in the background. The cold sore and herpes viruses, HSV1 and 2, they are a big concern because they have been known to migrate to the brain tissue and set up that inflammatory response. Likewise with mold mycoplasma. So mold in your environment, in your home, car, air conditioning, any plumbing leaks, those sorts of things need to be looked at and addressed and remediated if they're around. And Lyme-like illness and co-infections. So Lyme disease per se, which is a tick-borne disease, say in the USA, it's not recognized as Lyme disease in Australia, but we are aware of Lyme-like illness from tick bites and so forth. So other contributing factors, that low levels of brain-derived neurotrophic factor can lead to that shrinkage of the brain, heavy metal toxicity, and so things such as aluminium, cadmium, mercury. One of the key sources of mercury, or two, one would be the silver or amalgam fillings that lots of people have. And another source might be from seafood. Fish, particularly the bigger the fish, the more mercury they're likely to accumulate. And so my instructions or recommendations, which is a softer way of putting it, is for my patients to have smaller fish only. So oxidative stress, if you think about, like in this apple here, if you leave an apple sitting out on the bench, then eventually the air or the oxygen in the air is going to cause that browning. You can also think about it like putting iron out in the air. It's going to rust. And so that's oxidative damage per se. And so, or the effects of oxygen or oxidative stress. And microvascular damage. So this is, you know, how we're looking at vascular as one of the drivers. The high blood pressure is a big contributing factor to that and creating issues with those little capillaries. So sleep. Now sleep. I was reading something. Oh, that's right. I was listening to a podcast today by FX Med with the guy who wrote, one of the guys who wrote Brainwash. And he was talking about sleep and how it's probably the single most important thing to do to improve your brain health. And it is, well, I'd say there's probably, I'd like to add some other things to that too, but certainly sleep is right up there. And poor sleep does increase the cognitive decline risk. And the reason is that while we're sleeping, there's a process going on called autophagy. And I think about that like the cleaners are coming in to do a big, you know, clean, getting the mops and the buckets, the vacuum, the dusters. And if you think about that is happening in your brain and you need to give them time or give that cleaning process time to actually go ahead, then having a good quality sleep and a good amount of sleep around 7 to 8 hours is vital. And this is particularly important for ApoE4 carriers for that gene, because sleep is when they really need to be you know, clearing up any amyloid plaque, because they just from their genetic predisposition, they have a harder time with that cleanup campaign. So also having good sleep can help with that plaque, reversing that plaque formation. And things that you want to check are feeling agitated after the sun goes down, restless legs. If you're a snorer, then get checked to see if you have sleep apnea, because that is a big issue as well. Sleep apnea is literally a deprivation of oxygen to your body and your brain during your sleep. Having poor sleep onset, like not being able to fall asleep, or having the type of insomnia where you wake up constantly during the night, or waking up too early and not being able to get back to sleep. They're all things that need to be addressed. So prolonged depression can lead to that reduction in the hippocampal volume. And some prescription drugs can be a bit of a problem in terms of being anticholinergic. And I think, yeah, I've got the medications that are in the anticholinergic family. So this is a link that I've just popped in there. If you want to take a snapshot of anything, if you're on an Apple, you can go Command Shift F3, and that'll just snapshot that screen. And if you're on a PC, you can go Control Print Screen, but then you'd have to copy that into a Word document, like just do a Control V into the Word document, and then that'll drop that picture in there for you. Sounds a bit convoluted, but it works. But the anticholinergic family are thought to increase the risk of Alzheimer's. So it's worth having a look at the list and then talking to your doctor if there's any alternatives that aren't as bad in that particular role. So other types of contributing factors, cardiovascular disease, that blood pressure issues, gut, high cholesterol, smoking naturally, having head injury, being obese, of course, that's an inflammatory process in the body. just age is an increased risk, poor liver detoxification, chronic stress, diverticular disease. So that's the condition in the the large intestine. Drug use. Having your ovaries removed early for whatever reason, if it creates menopause early, then that can be a contributor. Autoimmune disease, because by its very nature is inflammatory. Stress, again, I put stress twice, so it is a big one, as you can tell. Having excess alcohol, that toxin exposure, and trauma. So I like this analogy that Dale Bredesen talks about, that Alzheimer's is like having a roof with many holes, and you want to address all those holes or try and heal or fix those holes, and just gradually, as you start to improve those things, you'll find that the just general health improves, and also the condition can slow down. This is further testing. So I've talked about all sorts of tests, but you might want to take a snapshot of that. But there's sort of genetics, lipid studies, having an intestinal permeability test done, getting your HLA genes done to see if you are mold sensitive, particularly if you have been exposed to mold. Homocysteine is an important methylation marker, B12 folate. The albumin to globulin ratio is in relation to liver function test. Your lipids, of course, I've got that twice, okay. Sex hormones and thyroid hormones, and a hair tissue mineral analysis or oligoscan to test for heavy metals and mineral balance in your body. Marcon's nasal swab, I've mentioned that. Having that dental checkup to make sure things are okay. Blood glucose and insulin, inflammation markers. Sometimes I suggest to my patients they have a stool test done. I think ideally it would be great if everybody did, but there's usually quite a lot of tests to do, depending on the person's goal, or, you know, if it's prevention or they've actually been diagnosed. And so I'm always conscious of costs and trying to keep, you know, the most important tests, and I'm going to work on gut anyway, usually. Some of those nutrients, and also checking for infections, having a mold and biotoxin test, and there's an online test called a visual contrast sensitivity test, which is helpful. And something that the specialist might organise would be an MRI. So this is a mold biotoxin test. And so this is showing, you know, some of the things that I might get tested within that. And here you can see that there are like 4 of those items are high, and this MSH is quite low. And so this is showing that that body, or that person's body, is reacting really strongly to something either in their environment or within the body. And so that would then send alarm bells, and I'd want to then further check for other things going on. For example, this is a mycotox profile test, and this is showing the results of somebody's mold exposure, and if they actually do have a mold infection. And you can see that they have several types of mold infection, and so then, you know, it's a bit of a process that patient will go through with very slowly detoxing, and that would have to also include finding out if that's within the home, and then doing something about that. This is one of the types of hair tissue mineral analysis that you can have done. And this person, you can see the cadmium is very high, lead is high, There's some mercury showing and also some aluminium. And also that cobalt is a bit high. That's a mineral. Sometimes if cobalt is high, I'd be wanting to also see what's going on with that person's vitamin B12. This is a patient's, it's called a CNS Vital Signs Cognitive Assessment. So it's an online assessment. And this was, he's a 57-year-old male. And this is something that he did, or his test results before he started following the ReCode protocol with me. And this was in 2018. And you can see that he had quite a few areas which were low average or low or very low. And the ones that were very low were composite memory and verbal memory, really important. And psychomotor speed was low. And so what we did then, I put him onto a program of care, and just out of interest, he has 2 copies of the ApoE4 gene. And so we definitely needed to work on him in a preventative way. And then this is the follow-up test. So this is 3 years later. Now you'll see that there's more items. So there's some things on here that in the second one, in this bottom one, that weren't tested in the first one. But you can see like this one here, social acuity, that's a new one that wasn't tested before. So we can't compare that. We can see that simple attention is still in the very low, but it has improved from 31 to 43, which is great. And you can see that everything's kind of shifted over at least to the average column, and there's nothing in the low column now. So he's actually going very well, and he's very happy. He still struggles with his memory, short-term memory, but overall he's functioning so much better, and he's just thrilled. I know his wife is very thrilled with the improvement. She's seen such a good change for him. So natural treatments that can be done. Well, first of all, as you can imagine, we have to test and assess any of those drivers or risk factors, and need to support brain health, reduce inflammation, address any toxicity and support detox, do metabolic testing and support that microvascular health, and reduce oxidative stress. And really, it's about creating an individualized approach for that person, depending on what's shown up for them. And of course, there's always going to be diet and lifestyle measures. So dietary measures, simple things that I recommend for everybody anyway, is eliminate processed white flour foods as much as possible, and certainly keep sugars to absolute minimum. If there's leaky gut, definitely staying away from gluten and processed foods. And eating lots more vegetables and fruit, preferably organic as much as possible, and having smash fish. So smash is sardines, mackerels, anchovies, salmon and herring, and preferably preferably wild caught as much as possible. And then lean, grass-fed or free-range meat and poultry. So the Mediterranean diet has been well documented in being beneficial for prevention of cognitive decline. And that is, not a very high carbohydrate Mediterranean diet, but lots of fruit and vegetables, some legumes, very low processed of grains if you're going to have any. The ketogenic diet is something I put most of my diagnosed cognitive patients on. And that is because with the ketogenic diet, you're actually producing ketones from the fat in the diet, and then ketones are able to produce energy in the brain so much better, particularly if there's insulin resistance going on. So eat only healthy fats. So healthy fats are things like avocado, those smashed fish, macadamia oil, extra virgin olive oil, avocado oil, a little bit of walnut oil, and nuts and seeds. Avoid alcohol. So alcohol, unfortunately, and ApoE4 people just doesn't go very well at all. It can increase problems. As Dale Bredesen says, that alcohol is a neurotoxin. Adequate fiber to support the microbiome growth. So certainly having things like psyllium husks and chia seeds, slippery elm, and that's going to help with improving the microbiome. Fermented foods can help to feed the good bacteria. And as I've said, going organic as much as possible. Now, fasting overnight is a key part of looking after cognitive health. And that would be for at least 12 hours. But for people with the ApoE4 gene, that really needs to be at least 14 to 16 hours. And that's from when you finish having any calories at night, preferably at least 2 hours to 3 hours before bed, to when you have any calories the next morning. And that allows for that autophagy to occur and also allows the body to really reset and repair. This is a cognitive health menu planner. And so this is just some various ideas. For quite a lot of my patients who are doing the ketogenic diet and also fasting, they usually have quite a late breakfast. They have quite a big brunch. They might have a bit of a snack in the afternoon, and then they'll have their dinner. So they're just all different options that you can have a look at, and you might want to take a snapshot of that. If you'd like a copy, you can just email our reception and we'll be able to get you a copy with the link. We might just send it out with the link anyway tomorrow. So lifestyle approaches, exercise, of course, is really important. Exercise actually increases that brain-derived neurotrophic factor, and it helps to reduce inflammation. And so you want to be exercising at least 4 to 6 times a week for 30 minutes or more. And sleep. So sleep is, as I've already said, I don't need to say any more about that. Very important. Other things are keeping the brain active, doing sort of brain training, doing things that, you know, use the muscles of the brain, so to speak, like learning new things or learning to dance or just socializing and having fun with people, taking up, you know, some online study or whatever. I mean, over the last year, I've been doing line dancing, and I found that really challenging in terms of cognitive, because it really makes you concentrate. But you also have a really good time at the same time, and it's loads of fun. Everybody walks out with a big smile on their face every time. Meditation has been shown to be really helpful, and it's worth getting one of the meditation apps on your phone or some, you know, meditation soundtracks or so forth on your favorite music app or good old-fashioned CDs. So some beneficial herbal supplements. Turmeric helps to reduce neuroinflammation and increases BDNF. And it's also been found that it helps to reduce the formation of the amyloid plaque. Withania is a really good herb. It helps to reduce the body's response to stress, whether it's, emotional, physical. It also has a little bit of anti-inflammatory activity, and it is mildly sedative, so it can help with sleep. Ginkgo biloba is quite neuroprotective. Just on that, it's a good idea if you're taking medication not to self-prescribe herbs unless you run it by your naturopath, just to make sure that there's not any contraindications with the two, your medication and the herb. Bacopa, that's a herb that's most often included in cognitive supplements. And Gotu-kola, which is a really terrific one. It helps to improve cognitive performance. Lion's mane, that's that funny looking fungus or mushroom. It looks like a brain, doesn't it? And so it is thought to stimulate nerve growth factor and promote cognitive function. Green tea, and also whole green coffee fruit extract. So that increases BDNF. And I was looking at some interesting studies before, this afternoon when I was preparing. And, it is quite exciting how it does improve cognitive function and memory. And I put most of my Alzheimer's or even prevention patients on that. Resveratrol, which is a very strong antioxidant, helps protect the cells and regenerate nerve cells. Quercetin is an anti-inflammatory bioflavonoid, and it's also very helpful, by the way, in COVID, like reducing symptoms, and for post-COVID syndrome. Selenium, vitamin E, glutathione, essential for detoxification, and ubiquinol, which is the active form of coenzyme Q10 for that energy production in the cells. So then we've got magnesium L-threonate, which is a type of magnesium that can actually get through the blood-brain barrier, which is a good thing for that one. Vitamin D, essential. Alpha-lipoic acid helps with heavy metal detox. Fish oil, particularly DHA. Melatonin, if there's sleep issues, and it's also a good antioxidant. Zinc. Choline, which is found in eggs, peanut butter, cauliflower, and almonds. N-acetylcysteine, it helps with glutathione production. And vitamin B12, and the active form of vitamin B6, but don't overdo it. I see too many people taking too much. Methylfolate, which is the active form of folate. And then there's a whole bunch of others there as well. So if you want to know more about the ReCode program or PreCode, ReCode stands for Reverse Cognitive Decline, and PreCode stands for Prevent Cognitive Decline. Dale Bredesen has his books, which you can buy, and also you can go to his website and read about it there. Some of my patients opt to subscribe to the program, and that means that with their test results, I put it through their portal in the Apollo website, and that generates their ReCode or PreCode report for them. So it's specific to what's going on for them. Loads of information in that website. It's just brilliant, really. And depending on which one that you subscribe for would depend on the costs, and all the costs are on the website. And then there's a couple of other books I think are worth having a think about, written by the same author, or Dr. David Perlmutter, and the other one, Brainwash, which I mentioned earlier. It's written by Dr. David Perlmutter and his son, Dr. Austin Perlmutter. And, you know, so much to think about with just that podcast that I listened today about screen time and phone time, and, you know, how it can affect mood so much and how the brain's functioning. So for further information, there's my website, there's also the Remedy Instagram page and the Remedy website. And I'm on Instagram as well and on Facebook. So I've got some information and recipes and so forth on my website, and you might find that helpful. So, do we have any questions? I haven't had any questions pop up in the chat box, so hopefully I've been answering everything as we go along. Thanks, Monique. So if you've got a question, now's the time to jot it down in the chat box. The chat box is down in the bottom row where there's a little chat balloon just on the bottom of your Zoom screen. Okay, so no more questions. We will be sending you the link for the video tomorrow, and also I'll get the, thank you, Andrew, I'll get the reception team to send out that menu planner as well to you, so you've got a copy of that. And I really hope you've enjoyed it. As you can see, there's a lot to think about. That doesn't have to be so overwhelming if it's we're talking about prevention. Obviously, there'll be a bit more involved with somebody who has a diagnosis or, you know, definite cognitive decline. Oh, that's an interesting question. How do you diagnose without the person knowing? Well, are you talking about you, or are you talking about a practitioner? I think if a person came to see me and let's say their husband or wife brought them along because they're worried about them, I would just be assessing their health and any of the drivers without necessarily discussing cognitive decline, if that was the aim of the game. So, but I wouldn't be, I don't diagnose really. A proper diagnosis of Alzheimer's would generally come from the doctor. Yes. Yeah, I understand what you're saying, Andrew. The last two books were Brainwash and Grain Brain, both by Dr. David Perlmutter. And if you just do a search for them, they'll pop up. And you can have a look at Dr. David Perlmutter's website. They'll be on there as well. And yes, if you need to ask any questions specifically, feel free to email us at reception, and the reception gang will send those through to me, and I'll be happy to get back to you on that. So have a great night, the rest of the night, and do all those things to look after yourself, and definitely sleep well. Thank you. Bye-bye.